This is Ned. He is our post-it patient. We have considered him during every decision that has been made concerning the development of our pathway, as our patients are at the heart of everything that we do. We've been working on the development of the assessment treatment model. This model was pioneered in Lewisham and has been replicated successfully elsewhere. In essence, this is a model whereby the function of assessment and treatment are separated. The focus on the admission ward is to undertake an intensive assessment for up to 7 days with an orientation towards discharge. The question as to why we would want to move to this type of model is answered by our patients who have expressed the following views. They want to be in hospital no longer than is necessary, and when they're recovering, it can be distressing to be surrounded by patients who are acutely unwell. And by our staff who have expressed frustration about not having the opportunity to utilise some of their skills and training such as DBT because they feel like they are firefighting new admissions and acutely unwell patients, alongside feeling disheartened by the fact that they are aware that in these situations they may not have had input into patients who are nearing their discharge as they are likely to be more settled. At the beginning of the summer, myself and one of our medical colleagues went to London to view the assessment model, which was developed by Dr. Rowe, being operated by South London and Maudsley NHS Foundation Trust. A few months later, ward managers, staff nurses and healthcare assistants went to London to view the model. There was lots of positive learning to take away and some challenges which we have worked through to make it work within our estate. In developing the model, we looked at all the guidance and best practice available, alongside papers that have been published about the assessment treatment model. The model has been mapped through hour by hour and day by day on the assessment ward, through to week by week on the treatment ward. The assessment ward will focus on positive risk-taking and the patient's next steps, with a decision being made as to what needs to happen to enable either home treatment intervention to be safely delivered at home, discharge from the service, or transfer to the treatment ward for ongoing stabilisation and therapeutic intervention. We will have daily contact and liaison between both the treatment ward and home treatment to enable the smooth transition of care. The treatment ward will be established to deliver longer-term intensive therapeutic intervention, such as psychological-based groups and intensive OT, with a view to proactively managing the patient's symptoms with the recovery approach, alongside equipping them to safely transition to the community. Some of the feedback that I have had from our staff about the new model is that they feel excited and are looking forward to utilising their skills and abilities to deliver a positive patient experience. The staff also relish the framework and clarity in their role in delivering high quality, patient-focused care.